it's Dr. Shirley from the Southside Health and Wellness Campus, where we're cutting through all the healthcare noise for you. It's back to school time again, and there are a lot of things out there that all you parents are thinking about. Getting school supplies, updating your child's wardrobe, and of course, the dreaded sneaker shopping. But unfortunately, there is one thing that a lot of parents are not thinking about, and that's backpack safety. As your child grows, their everyday activities are in large part what determines the overall health of their spine, especially their posture. Slouching, watching TV, using electronics, texting on a cell phone, and even reading a book can put extra stress on the muscles that are attached to the spine. Then, as a child goes through a growth spurt, if there is uneven tension in their spine, the muscles can pull on the bones, causing a twisting effect to occur in the spine, a condition we call scoliosis, which looks like this. Yikes! Can you imagine your child's spine looking like this? Of course, this can be genetic and can be the result of many factors, but the factor that's most in their control is their posture. Now, scoliosis is a more extreme problem that can occur, but some more common issues that could result from poor posture or improper backpack use include headaches, migraines, neck pain, back pain, tingling or numbness in the hands or arms, and even increased fatigue. So today, we are going to focus on how to make sure that your child's backpack is just the right size for them and it is not in danger of putting damaging amounts of pressure on their vulnerable little spines. First, make sure that you buy a backpack with wide padded shoulder straps. This helps disperse the weight of the backpack rather than putting larger amounts of pressure over a small area of their shoulders. Using a chest strap and a waist strap can also be very helpful. Next, make sure you don't buy a backpack that's too big for your child. Remember, the bigger it is, the more junk they're going to stuff inside of it and the heavier it's going to be, causing more damage to their spine. To determine the proper size, keep in mind that the child's backpack shouldn't be any more than 4 inches below the child's waist. This is extremely important. Your child's backpack should never exceed more than 10% of their total body weight. So if your child weighs 100 pounds, their backpack should not weigh any more than 10 pounds. If you notice your child leaning forward to try to counter the weight of their backpack, it's way too heavy. When loading their backpack, instruct your child to place their heavier books closer to their spine to help with proper weight distribution. And the last tip, the brighter the backpack, the better, especially if your child has to walk to school. A bright backpack will ensure that your child stands out to drivers, especially in the winter when it gets dark early, decreasing the likelihood of an awful tragedy. Remember, an ounce of prevention is worth a pound of cure. In other words, it's much easier to prevent problems with your child's health than it is to wait until there's an issue and then try to fix it. If you enjoyed this video and found it helpful, please give us a thumbs up, subscribe to our channel, and hit the bell to receive notifications of other helpful videos we produce for you and your family's health. Thank you for watching.